Is it recording? Yeah, it's recording. No, I was just gonna say that. It's still recording. I was just gonna say that, you know, ladies don't like us just for our stunning personalities.
Mm-hmm.
You be
You
quiet.
see the look on her face?
You're a hoe anyway, because nobody cares about you.
What was that?
Well, what was that?
He doesn't have no comment because he's a hoe, so it's completely different.
Damn.
So be quiet.
Use a hoe. Hoe.
You want me to play your song? Here.
No, don't play it. We're good.
Sure.
We're in class. We're recording.
Or do you want me to play your sad violin song?
Whatever you want to do, Sequoia. Whatever you want to do.
So anyway, so going back to kids, like what I'm dealing with right now.
Oh.
Bad things aren't supposed to happen to little kids. And especially if you're a parent, when you do experience that, when you go on a call involving a traumatic injury to a kid, they we tend to internalize it. We tend to put our own kids in that position. So it's very stressful. Pediatric calls are some of the most stressful calls we go on. I've been very fortunate in my career. I haven't really had that many critical calls. Really, the only critical call I've had on a pediatric is the one I've told you about, that 19-month-old that got hit by the H2. And obviously, that wasn't a good outcome. The next one, although thankfully the kid came back, but it was a pediatric drowning. And that's been the extent of my serious pediatric calls. I mean, I've had others where kids fell down, they hurt themselves, got boo-boos. I've had asthmatic kids. I had one on Saturday. I had a kid that scared the living shit out of me. It was a vehicle accident, and the kid's in his car seat in the back, and we're trying to wake him up to check on him, and he's not waking up. And I'm telling you, I'm doing some gnarly, painful stimulus, and this kid is not waking up. I'm like, get me a helicopter. I get him out of the car using his car seat. I'm about to cut the straps on the car seat. When he finally wakes up, he's kind of like, you know, how kind of like how Paul wakes up slowly, like, oh, I'm the prince right here.
Damn, Lou, you coming throwing those too? God.
What?
You throwing jabs too? God.
Why not?
Man, I'll take the Prince part.
Nowhere near it.
Hey, I'm trying to save my own ass here.
It's all right. I'm always in the.
We'll have to deal with this tomorrow.
True. The only saving grace I have is I sign your shirts.
There you go. See?
Without my signature, you don't pass. So smaller bodies, but traumatic forces are more widely distributed. One thing to remember, and I kind of talked about it a little bit, and I'll talk about it more with pediatrics, but understand that kids, when it comes to surface area, they have more surface area than an adult. So as a result of that, they lose more heat, or they lose heat faster. So something to think about in the winter when they're involved in an accident, they get cold very quick. Very small children also very susceptible to the cold. The other thing about them is, like, for falls, when their heads are bigger in proportion to the body than an adult, obviously, they tend to land head first. So be thinking about the head injuries. The other thing is they have weaker neck muscles. So more possibility of head and neck injuries, spinal injuries. Now, how are we going to assess their mental status? Can you ask a 3-year-old like Paul what day of the week is it?
No.
No.
His old brain won't even function right, so he wouldn't remember.
It takes him a minute to get the wheel turning. You know what I mean?
To get the wheel turning?
Or his someone smacking his head to get it actually turning correctly.
Ha ha ha.
Now, so my question is, how do you establish their mentation, their mental status? I mentioned it earlier.
Painful stimuli?
But how they look?
Okay, what do you mean how they look?
Like their body position, muscle tone, stuff like that.
Okay, they might be limp, yeah. But there's something else. I talked about it yesterday. It was in quiz today, and so we talked about it a little bit more this morning. What did I say about kids?
Let's start over.
Frankie, what did I say?
On what part?
Well, I want to see if Frankie, first off, is awake.
Yes, I'm awake.
Are you here? Let me see you on camera. Where you at?
No, I don't want to turn on my camera.
Why not?
Because
You show me mine, I'll show you yours. I mean, you show me
What?
yours, I'll see mine.
Damn.
Came out the wrong way.
anyways, so we were talking about the kids, right?
Come on, let me see you on camera.
No.
Why?
I'm
Are you
on
doing
camera
something
and I
else,
still look
Christian?
like shit.
He's doing something he's not supposed to.
Yes, exactly.
Ew.
Too much TNI.
Am I?
Where are your minds going? We just started doing something we're not supposed to. Anyways, about the kids.
Assuming.
Anyways, you guys are supposed to get Paul with these. I'm innocent.
Bullshit.
Anyways.
So my question is, how do you know the pediatric patient's mental status? How can you assess it?
Don't you tickle the bottom of their feet? Or you spank them or something?
Damn, that's abuse.
That's a way to okay, for infants. Why do
Don't you do
Why
like
do we
the
flick the
skin and all that?
huh?
Don't you observe the skin?
No, mental status. I'm talking mental
Oh.
status. But my question, because Frankie brought it up, is why do we flick the soles of the feet on an infant?
Because it's a reaction they.
What reaction?
The reflex
A reflex to do what?
of their nervous system.
To do what?
The stimuli.
Yes, it's stimulus to get to stimulate the reflex. What reflex? What is it going to cause the child to do?
Retract.
No. Is what they do instead of spanking you. So when Paul was born, they smacked him in the ass to get him to breathe.
Which,
They
never
don't
mind.
do that anymore. So when Sequoia is born, they flick the soles of her feet. Why? And Paul, don't say because she had no ass.
That's Paul.
Damn, that's cold-blooded.
Yes.
That's what Paul was saying.
I'm glad I don't have an ass. I don't believe men should have
No.
asses.
That's
No, you're
sad.
saying
That's
that
sad, Paul.
Sequoia doesn't.
I still make it in this world.
You notice how he's deflecting there, Sequoia?
I never said that.
So Frankie, why? Tell me why.
I don't know. I guess like Sequoia and Rosie said, to get a reaction out of them.
What reaction?
To cry?
Whoever did your CPR class was not thorough.
To be alert.
No, it's a reflex to gasp for air. That's why I said they used to smack them in the butt to get them to go to take that first breath, but they don't do that anymore. They flick the feet for them to go take a breath. So that's why we flick the soles of the feet, but that's not the answer. What is the answer? The answer I'm looking for as to which I said yesterday, and it was in the quiz, and we talked about it this morning, is you ask the parent or the caretaker, how are they acting right now compared to normal? Had a kid come in at the San Diego Zoo that fell down, hit his head. And so I asked the mom, how is he acting right now compared to normal? And she says, there's something off about him because normally he's bouncing off the walls and fighting with his brothers. And this kid was just sitting there quiet. So should I be concerned?
Yeah.
Yeah. So in the trauma case here, what do I want to ask the parent?
Is he acting normal?
How is he acting right now compared to normal? So it can tell us cementation. Is there any type of head injury? All right. There's a method to my madness, ladies and gentlemen. I'm mad to begin with, but now it's madness. I think it's time to go to Redoso.
Oh yes.
But I gotta find out when they're doing the free rooms again.
Road trip on Lou.
Hey now.
That's a
All I
good
have to say,
celebration.
I'm in.
gas or ass, one of the two.
I'll take the floor.
I'm taking the floor.
I'll sleep on the floor.
I didn't say you had to sleep on the bed with me.
I'll use Sequoia. Not Sequoia.
I'll be your big spoon, so don't worry. Got you.
Oh yeah.
I thought Rosie was in the middle.
Hmm.
How quickly I get forgotten. I'm just taking attendance again real quick. Make sure everyone's here. Other people are trying to sneak in.
Yeah, we have more people than we did in the beginning.
Yep.
Anyways, what are you taking to you tomorrow, Paul?
No, I don't have time to stop. Remember, I get off at 7.
Oh, you could show up late. It's okay.
No,
Yeah.
I'm not showing up late.
We'll excuse that, especially if you take us something to eat.
I'm not showing up late to class.
All of a sudden.
All of a sudden, I don't never show up late.
Yeah, you did. Today you did. After I woke your ass up.
I was here, but I was asleep.
Sure.
You see, now because you were asleep, now you gotta buy breakfast.
No. You're off today, aren't you?
No.
Me?
Hey Lou, they were talking about going on that trip with you on Friday, and then they really missed that. Like they were missing you on that.
Get the fuck
They
out
wouldn't
of
stop
here.
talking about that.
Okay, let's go to his house.
Something else.
He's about to get his ass beat in 18 minutes.
Are y'all seriously gonna tell me y'all didn't? What the? That's all y'all were talking about because y'all couldn't go. So you
So
set
anyway,
them up.
so because Paul's about to get his ass beat, Paul is 3 years old.
That's my point.
And so when we're talking about trauma, remember the forces that are involved in trauma. So if he receives a trauma to the chest and or abdomen, are the injuries going to be worse?
Yes.
Yes.
Yes. Because one, all the organs are more bunched up together. Number two, how much protection do they have?
Not much.
Not much. So a lot more susceptible to abdominal injuries, including the liver and the spleen, because of how they're compacted and less protection. Now, I'm going to use Jennifer. I know you're around. No, actually, I take that back. Jennifer already picked on you. Who was it? Valeria. This is Valeria.
Yes.
Hi there. So, Ms. Valeria, you're 6 years old. What is happening in your bones?
What do you mean?
What are your bones doing as you grow up? As you grow up?
They're also growing.
Yeah, they're growing. Do you know what part of the bone is where the new bone is growing out of?
No.
Okay. Let me get back on here. All right. Oh, I gotta share. Do I have to share? I'm behaving like Paul this morning. Do I have to share?
No.
Sharing is caring.
No, it's not.
Depending.
Yes, it is, depending on what you're sharing.
No, it's not.
All right.
There's the manhole coming out.
Why should it have to go to that? God.
Okay, so you see, that's a bone. The shaft of the bone is called the diaphysis. Right up in here is what we call the epiphysis. It is there, we call that the epiphyseal plate. This is where the bone is growing at. Basically, so here's a kind of a so this gap right in here, actually, this gap right in there, that's the epiphyseal plate. And so what happens is new bone cells are created. And as that is growing, it's pushing the bone down, or it's getting bigger. So, do you guys know how the Hawaiian Islands come about? Number one, and why the big island down here, and then they kind of go a little bigger. How they're kind of shaped in that motion.
Yeah, it's a tectonic shift over like a lava hotbed underneath. Like the plate is moving over that spot.
Exactly. There's a volcano underneath the big island. And so as the lava comes out, it goes to the water. And it cools down and it solidifies because it's rock. And so the island basically is growing and growing and growing. And as you mentioned, it's a tectonic shift. So the plates underneath the earth, so going that way. And so eventually the little island, I don't know what it's called, but the little island will disappear. And eventually, in millions of years, probably, the big island will be the little island. So this is going to come up in here. And there'll be new, bigger islands forming behind it. So then this one will get smaller, this one will get smaller, this one will get smaller, this one will get smaller. Eventually, that's going to disappear. And then probably in millions of years, if the world doesn't end before then. So, all right. Did that help understand what's happening with the bones?
Yeah.
All right.
Is that how our teeth get pushed out?
The other teeth are there already. I saw a cross section of the mouth, and you see the teeth above it. They're ready to go to be pushed
So
out.
as you grow, the new teeth is just pushing out the old teeth.
Exactly.
Oh, okay.
Exactly. All right. So, Valeria, so that was the answer to your question, or to your example. So the bones, as new bone is created, it elongates it, makes more and more and more. About what age do we stop growing bone?
Male is 18, I think. No.
Yeah, 17, 18. So that's how they can tell when they do an X-ray how old the person is, because they can see that epiphyseal plate. And then what happens when you get to be Rosie's age?
You're tall, very tall.
You get canas.
Tocayo, be careful.
I don't have any. That's Paul.
Yeah, you probably color your hair. That's why.
Boom! That just happened. Thank you, Luis.
Got
Way
you.
to come back on that. Yeah, you probably do color your hair. I'm gonna go back on mute.
Waiting for someone to
Yeah,
hit them.
get your ass back on mute.
So shut up, old timer.
Hey,
Why
I
do you think Paul wears a hat?
like my gray hairs. I'm good with it.
So anyway, going back to the bone. So eventually, and it does happen to men too, but it's more prominent in women. Bone eventually starts becoming brittle. So something else to think about. So one thing we want to do when we're assessing pediatric kids, and again, this comes into play with the pediatric chapter, and that is the pediatric assessment triangle. What is it that we're looking for in the pediatric assessment triangle? Josh. Give me one component of the pediatric assessment triangle.
Appearance.
Huh? Mr. Josh? Not sure. All right, Miss Amber. She left. Oh no, there you are. Miss Amber, can you give me one component of the pediatric assessment triangle? Demia, can you give me one component of the assessment triangle?
Not off the rip, but I can find one.
All right, don't worry about it. Ashley, can you give me a component of the pediatric assessment triangle?
One of them is appearance, no?
Yep. What are you looking about for in appearance?
Like their color and if like how I guess like if they're cool or hot or something like that.
Uh-huh.
And then like I guess if they're crying or like crying and like screaming, like if they're able to produce sound, I guess.
Okay. So
Can I answer?
how do they look? Remember the general impression? It's about how do they look to you as you're approaching them?
Are they having trouble breathing? Are they using accessory muscles?
Now, that's another component, though, as far as the breathing. The appearances, as you approach that kid, how do they look? Do they look like crap? Do they look like, are they tired? Are they limp? Do they look like they don't care?
So it's the appearance, work of breathing, and circulation to the skin.
Okay, that's all the components, but I didn't want all of them yet. I was just talking
Oh.
about appearance. All right. So now, Rosie, you talked about work of breathing. Is breathing important for kids?
Yes, because they're mouth breathers, right? Or nose
Well,
breathers.
only for the first several months of life, yeah. Anybody?
That what?
Shoot. Oh, why is breathing important for kids?
Because it depends on the respiratory system.
Yeah, they lean on their respiratory system. And then you look at the color, their circulation. What's their skin color? Acid, mottled, pale. How do they look? So something to see as part of your assessment. Look at that kid. If something's off about them, then something's off about them. So, all right. What's the important thing when we talk about kids and trauma? as far as their circulation goes. I mentioned this in shock.
They compensate very well.
They compensate very well. However, what's the downside of that?
They decompensate quickly as well.
They will compensate very, very quickly. So, be very, very observant when it comes to trauma in kids. I had a kid one time, or two kids, and I don't remember if I told you the story. They were riding with their dad. The dad was driving eastbound on the highway, and this car, it comes around the bend, and this car is making a U-turn right in front of them. And so the dad T-boned the illegal U-turn person. So we get called out, and one of the kids is complaining of abdominal pain. And then come to find out, the second kid was also complaining of abdominal pain. Well, what's the concern?
Can you repeat that?
What is the concern of two kids, or even just one, complaining of abdominal pain?
Internal bleeding.
Internal bleeding. It's what we call a hot belly. Possibility of there being internal bleeding from the abdomen. I flew the kids out. I didn't want to take any chances. And what I'm complaining of sudden sharp pain to the abdomen after the accident. And the second thing is the dad got arrested for DUI or DW. It wasn't because he was careless. I mean, yeah, it's stupid driving and having two kids. They were like 9 and 11 or something like that. But, you know, he didn't cause the crash. It's the guy that made the illegal U-turn. But regardless. So we have a traumatic pediatric patient. What are some of the considerations when we're dealing with pediatric patients? I mean, we're going to put them on O2, right? We're going to control any major bleeding. We're going to keep an eye on their pulse. What about when we put them on a backboard?
What age though?
They're pediatrics. Let's say a young kid.
Then if they have the car seat.
Before preteen, huh?
Well, if they still in car seats, you could use a car seat to put it on the unit.
All right, good. We'll keep them in the car seat if they're in there properly. What else?
Extra padding on the shoulders to maintain the head.
Why?
Because of the airway.
Okay. Yeah, remember their head is a bigger proportion of their body, so we need to take that into account. So how do we do it? You said something about the shoulders.
You apply like towels or blankets on the shoulders.
Okay. Yeah, put folded sheet or towels underneath the shoulders to lift up the shoulders to bring the airway more into alignment. What about perfusion? How can we check perfusion? There's two ways.
Circulation of the skin.
Okay, we'll see the skin signs, but there's still two other things.
The work of breathing.
No. All right, just to clarify, I'm talking about blood pressure. At what age do we really start taking blood pressures?
7.
About 7 years of age. Before that, how do we check?
The what is it called? The trick.
Cap refill.
There you go, the capillary fill.
You do nail bed. You could do the meaty part of the thumb. You do it on the heel of the foot. Keep reassessing these pediatric patients. They deteriorate very, very quickly, like I said, or like Lee said. They decompensate very quickly. So you want to stay on top of it, make sure they're perfusing well, make sure their pulse is up. Again, capillary refill, very, very good indicator of perfusion with kids. All right. So, all right, questions?
No.
All right. So, our next category is old people like Paul. So, what injuries are common amongst the old farts like Paul?
Bones.
What was that?
Your bones.
Bones. Okay, but what's the mechanism?
Falls.
Falls. Something to remember about falls with geriatric patients. Do not assume it was a mechanical fall. And what I mean by mechanical fall is, oops, I tripped, I fell down. Always ask them what happened and if they were feeling like dizzy or lightheaded. There could be another reason why they fell. They think they got a trip, but ask them. What was that?
I said, Paul, why didn't you use your life alert?
Because he knew you were on?
No, the commercial where I've fallen and I can't get up.
Yeah.
It's because he has memory loss because of his age, so he forgot he had one.
You want me to put you in my facility? I got dementia and Alzheimer patients.
You could get a discount, Paul.
A lot of jokes.
You know, those not only are they used for when they need help, but also they have to be reset about every 12 hours. In other words, they have to hit the button about every 12 hours to let them know they're okay. If they don't get a signal, if they don't get a reset in that 12 hours, then they'll send somebody over to check them out. I had one lady, I remember we went, we were able to get in, I forget how, and EMS, no answer. Like, oh crap, she's dead. Walk into the bathroom and she's laying on the floor next to the toilet. I'm like, fuck. And then what I see is she's covered in ants. I'm like, son of a, this is a gnarly death call. And then she starts moving. Like, crap. So I was an EMT at the time. The medics get there. I forget what else was going on, but we loaded her up and we went code 3 to the hospital. Now, two things about that particular call I remember, besides the ant, we call her the ant lady. Number one, that was the very first time I drove code 3. So I was nervous as hell. The second thing is, as I'm driving code 3, my sirens go out. Like, fuck. And there are trying to controls, trying to get the siren back and everything. And
were you working for life?
No, this was California.
Oh.
No, actually, the owner actually did spend money on equipment and on personnel. So it was pretty cool. It was a very nice company to work for. I miss
you
that.
have to go wee woo out the window.
I thought about it, but that was before Despicable Me. This is 1990. This is 1998 that it happened.
I was only
Shut up.
years old.
How old?
7.
So you're born in 91. The year after I graduated high school.
I was 11. Paul, you were 21?
Yeah. Funny. Good shit. Good shit. Lou.
Yes.
Can't be taking this stuff. Can't be taking
Huh?
these old jokes. We can't be taking these old jokes like this.
It's not him though, but it's you. Nothing to do with Lou. It's you.
What did Sequoia just say? Wee, whatever. Oh,
That's a good one. I gotta admit.
good shit.
Wait, so quiet, Paul?
Some reading my
You
emails.
remembering the old times or what?
I don't think he remembers any of that.
Those are good days. Those are way better days than now. I'll take those days back.
How long ago was that?
Whatever.
1930 or what?
I thought it was 8.
BC or EC?
Rosie, how old are you? Like 35? You're like 5 years younger than me.
33, bro.
Oh, my
Wait.
fault.
Get it right.
My fault.
Yeah, get it right.
All right. Sorry, that was my boss. I was just filling him in on the decision. Man, that was a hard decision to make. It sucked yesterday.
For what?
He left it up to me to decide whether to yank the classes off in-person training or keep them in class.
For like the whole class or like the whole students or what?
Yeah.
Man.
Yeah, so I struggled with it. I spent like 3 hours on that yesterday. It really sucked. All right. All right. Hey guys, just in the future, I know I'm kind of talking to the choir, but if you guys leave early or need to leave early, just send me a message. Because apparently people are noticing that people are leaving, so. And here's the other thing. If I call on you and you don't answer me, I'm going to kick you out. Because I'm assuming you're sleeping or you're trying to do something.
Jasmine.
Be quiet, Paul.
Rosie. You're asking for it.
Nobody wants to hear you, Paul.
You're just gonna hear Paul. Wee.
You're asking for it, Rosie. Tomorrow I better get Starbucks.
Wah. That's all I hear.
You better get Starbucks tomorrow.
Or what?
Rosie will get it for me, not you.
Sure. Y'all both better get it.
I'm hell to the no.
I'll get you one, Luis.
Give me a donut with the raspberry stuff in it.
What do you want?
You're interrupting, Paul. I'll get you one, Luis.
What do you want?
Well, some with the fruit in it.
I'll put some laxatives in it.
Okay. All right, moving on.
You're gonna be shitting your pants all day, bro.
Damn
All right,
old
so
and shitting on yourself?
going back to geriatric patients, guys. So we got to think about the reflexes. Like I said, don't assume that it's a mechanical fall. Try to rule out some other issue first before you go with the mechanical fall. Fractures are very common because of the brittle bone. So Rosie were to fall down, you look at her wrong, she'll break a hip. So fractures are very, very common, especially because of osteoporosis. They also don't move as fast.
I actually had one yesterday that she was like she got up on the toilet and like she went forward. I guess she missed her step, fell backward, smacked her head.
Ow.
It was a crack or like an open in the back.
Ouch. Bleed a lot?
Yeah, she was on blood thinners.
Yeah, that's even worse. It's bad enough to begin with. Remember, it's very vascular. So they'll end up bleeding a lot, but then you have blood thinners. Did she get sent to the hospital?
No, they just put they just cleaned her up and everything like that.
Oh my gosh, that is such liability. Do you remember what I told you guys?
Well, she refused to go to the hospital anyway, so we couldn't do much.
Yeah.
She's one of the residents that's like pain in the ass.
I know the feeling.
I thought residents didn't have a choice.
No, they do. They're still independent.
Oh, okay.
So guys, so this brings up a very good point. Why should that patient have gone to the hospital?
The blood thinners.
Okay.
Or internal.
She could have bled
Internal
out.
what? Internal kidney?
Because she hit her head. No.
Yeah.
Okay, we have a traumatic. We could have possible traumatic brain injury. We could have bleeding in the brain, and you throw in the blood thinners. They're going to bleed a lot more. So, what are some of the things that you might see in the patient that has bleeding in the brain?
Hematoma.
ICP.
Okay. When you say ICP, that just means intracranial pressure.
Bleeding in the ears, liquid.
Okay, besides the obvious outward signs, what are some of the inward signs you'll see? So somebody mentioned increased intracranial pressure. What are you going to see?
Increased blood pressure.
So hypertension?
And, yeah. And well, the Cushing reflex.
Cushing's triad, yeah. So it's hypertension. What else?
Wouldn't their eyes be like dilated?
Talk about Cushing's. We'll get to that in a minute. What about Cushing's? Hypertension. What else?
Brady.
Cardiac.
Okay, decreased or no more heart rate. What else? See, this is all part of defending your answers, part of the effective grade. What else?
Whitening pulse pressure. I mean,
well, that's the hypertension.
Yeah.
Hypertension, normal to low pulse, and what 1.5 more. Respiratory rate. Decreased respiratory rate, and the half is, although they're starting to put it in instead of the decreased respiratory rate, is abnormal respirations or an irregular respiratory pattern. Anybody know which one?
What was your question?
Which abnormal respiratory pattern are we going to see on a head increased intracranial pressure? BIOTS, B-I-O-T, apostrophe S. BIOTS.
BIOTS?
Yeah. B-I-O-T. Be grande for you Spanish speakers.
So it would be quick and shallow.
Yep. All right. So what else are you going to see? So you can see increase in the cranial pressure. We talked about, what were you saying, Rosie? The pupils?
Mental Sequoia.
Man, now she's ganging up on Sequoia.
No, I just said she said that.
Sounded like you, though. I could swear it was you. You have a very unique voice.
I mean,
Take
if
it.
it's true, I'll
Just
take
take
it.
the credit. Just take the credit. Don't
I'll
worry.
take it. Yes, it was me, Lou.
Okay, but to give you full credit, what about the pupils?
They're dilated.
Well, forget about the medical marijuana. We're not talking about that.
Wouldn't they be off?
Well, it's a neurological, so it's gonna affect the pupils. No.
Precious. What about unequal pupils?
Yeah. That's what I was looking for.
All right, what else might you see?
Signs of shock.
Confusion? Huh?
Signs of shock.
Okay. Talking about confusion, we're talking about ultramental status, we're talking about nausea, vomiting, projectile vomiting.
Contusions also.
Contusions. Well, yeah.
Definitely.
Yeah, from the injury. What else? All right, so what else are other considerations?
Give me 3. Give me great. No, give me 2. No, give me 3.
For a geriatric?
Give me
Yeah.
3.
Or
3 and 3.
I want 3 too.
Do what?
Just say we're pausing. I want 3 too.
You want 3, 2 what?
I don't know. That's what he's saying. He wants 3, so me too.
Oh, he wants a threesome.
Oh man, Lucio.
You know him, really?
No comment.
I bet. All right. So with geriatric patients, we got to remember the changes that are occurring. Another big thing, kind of with kids in the head, here now they have an abnormal curvature of the spine. Do you guys remember which curvature we're going to be talking about?
kyphosis.
Kyphosis. So be considerate, maybe some padding to help with the hump. Also remember dentures. One thing I'm going to tell you about dentures is make sure you keep track of them if you have to remove them. How well do they feel pain?
Not too well.
Not too well. So they might not be able to tell you everything that they're feeling because of the fact that they don't feel pain the way they used to. You got all the medical problems that confounds the issue, and all the medications, including possibly beta blockers. So you really, like I told you before at the start of this section, sometimes you have to be a psychic. Try to think about what other injuries. Is there really, other than what we've already talked about, is there really any other differences or changes that we would do in treatment for a geriatric patient? as opposed to a regular trauma patient?
Just use padding on the spine motion restrictions if necessary.
Yeah. Okay. So any questions on geriatric patients?
No.
Nope.
Okay. I won't pick any of you. You know, it's funny. I only see 5 people on. Guess who the 5 people are?
The main ones. Ooh,
The same
ooh.
as always.
The 5 years.
I think everybody just sits back and watches the show, and they're eating popcorn.
So we should get like extra credit and get skipped for a test because we're always answering.
Yeah,
Gotta
no.
give us something though.
Just saying, you know.
Uh-huh.
Or I could turn off my camera and just chill too.
You wouldn't do that. Anyway, so like I said, I won't use any one in particular, but we have cognitively impaired patients. In other words, how is there a challenge to assessing them?
Because
Yes.
Alzheimer's, like Paul.
Okay, yeah, it could be from Alzheimer's, but I'm talking about like mental retardation, some
Yes,
sort
it
of
is.
cognitive impairment.
I mean,
You
but
wouldn't have
it
like
is,
an
but you
age.
still talk to them.
No age, just in general, a cognitively impaired patient.
No, I'm saying like an aide. Won't you have like the parent or a nurse, like an aide
Okay,
with
they
them?
tell you they suffered trauma. Or better yet, you go on a traffic accident and your patient is cognitively impaired. You went on a vehicle accident. It was Paul's vehicle, a short bus, and so you need to assess the patient.
I knew it. I knew it was the short bus for him.
So you will use a parent or a caregiver to help you.
Okay, good. You want to use a parent, but let's talk about other challenges.
But you would still ask them, though. You would still ask them if they're hurt anywhere because they'd be able to show you if they were. You're still not going to take them out of the equation asking them, would you?
Yeah, but some cognitively impaired patients can't tell you, can't communicate with you,
Yeah, they don't even
or
know
they
what's going
communicate in
on.
their own way that you can't understand. So yes, talk to the caretaker, but you still have to keep in mind they can't tell you. The caretakers say, yeah, they have X disease, and they take Y and Z medications.
Mm-hmm.
But how can you know what's wrong with your patient?
Looking for signs.
Because
Doing
it's
their
your patient.
primary assessment, looking at their MOI,
signs.
surroundings, and everything.
Yeah, because is your patient going to be able to tell you, my head hurts? Oh, I have a bad headache. Oh, my
No.
stomach hurts.
I mean, looking at their findings, like what are they guarding their stomach, holding their head.
Okay, maybe. But again, you got to think about, I don't think you guys are really picturing the same thing I'm picturing. Imagine Paul is sitting there in a motorized wheelchair or some sort of wheelchair, and he's like this. And Baba coming out of the side of his mouth.
Wouldn't they have like a medical tag or something on them?
I know, but what I want you, I'm not talking about medical history, allergies, meds. We can get that off the caretaker. I'm telling you, when you have a headache, what do you say? I have a headache. When Paul's around, what do you say? I have a headache.
Mm-hmm.
But can that patient that has the babas coming out there, Can they tell you straight out, my abdomen, or they wouldn't say abdomen, my stomach hurts?
No.
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 No. So that's what you got to picture. And so that's where the assessment comes in. So still do an assessment. Understand that there's going to be challenges with communication and cooperation. What about that autistic 8-year-old Luis?
That's even harder.
Why?
They're not gonna be able to like sit down.
Responsive.
They're gonna be like too anxious or.
They're gonna be guarded. Also, they're gonna be and sometimes they don't even talk. Like they're not responsive.
All right. So really what you got to do, as we were talking, is looking at that mechanism. Look at the force. Where were they at? You want to look at the patient. You want to do your assessment. You want to try and figure out what's going on. Somebody's dog wants some loving.
Sequoia.
No, mine's being a pain in the butt right now.
They say
He
that pets
cries like
resemble their
a
owners.
human.
Just like the mother.
Be quiet.
All right. When you are treating those patients, remember, involve the caretakers. All right. How do you involve them?
Asking for their ETRC,
Okay, what else?
medications, history, onset.
What else?
Ask how they're acting compared to normal.
Okay, what else? How about helping you with some of the treatments? It might be easier to manage the patient when they're being cooperative because their caretaker's right there with them. Now remember, caretaker could be like a home health nurse or a private duty nurse or even the mother or the father. All right. What else? Is there any difference, or really actually nothing else with the cognitive? So in general, to reinforce and to review, when you're doing your scene size up, obviously you want to look at your mechanism of injury. Take that into account. As you begin your primary, remember your general impression. Look at, again, how damaged the vehicle is, and then look to see how the patient is. If it's a kid, again, what are we looking for?
Chest or trauma, like
No, we remember, it's general impression and then the level of consciousness.
and circulation.
No, that's in the second three. The first three: general impression, level of consciousness, see complaint, or apparent life threats. Okay. Then we go into the ABCs. Nothing different there. Give them all U2 if needed. Protect the airway. Look for controlling major bleeding, skin signs, right? Hi, Mom. La Precious ahí anda bien flojita y se mueve. Precious. Le hablo, no se mueve. Precious. Psst. Ah, she's ignoring me. All women ignore me. Well, except my mother. All right.
Telling on you, Lou?
What?
They were telling on you?
For what?
To your mom.
I said my mother doesn't ignore me. I'm trying to see what's different from what we already do or have done in the past. Have you guys noticed anything different in the assessment of special populations or multi-system trauma? Or anything that I missed as we were going over the individual groups?
No, not really.
So you have, man, I swear, Sequoia, you and Rosie are like two peas in a pod.
Yeah.
So when we're talking about trauma assessment and a multi-system trauma, you got to think about all the forces. You got to think about all the different systems. One thing to really remember, especially high impact, is if it's severe enough to either A, kill somebody or cause major injuries to somebody, then it's probably significant enough to do the same thing for other occupants of the vehicle. Look at that car crash last week. How many people died in that accident?
6, 7.
7. And there was what, like 10 people in that car?
Yeah.
How the hell they fit all those people in that car, I have no idea. No idea. But again, the mechanism, how fast were they going? How fast were they going?
I think they're going like 90.
Yeah,
I think they're going like 90.
yeah.
Dang.
And then how sturdy was that car? How sturdy was that car? Roof. Roof. Gotta love the echo. So things to look at. I wish I could share my memories with you guys of the different traumatic events I've been to over my career. Falls, motorcycle accidents, traffic accidents, assaults.
Do you have one that specifically haunts you to this day?
That specifically what?
Haunts you to this day?
I still couldn't hear you. Caused me to what?
To like another, it haunts you to this day.
Really, the only one I wouldn't say haunts me, but that I remember that was pretty bad was, well, actually, it was a kid, so technically it's a bad kid, but he was 16 years old, and he was trying to tag a freeway overpass sign, and he slipped and he fell to his death. When we showed up, he's laying on the freeway, eyes open. He looked like those Egyptian figures where they're all crooked like this. His femur was sticking out. His leg was partially amputated, almost completely torn off. But you see the distal end of the femur sticking out. You see several chunks of bone down the freeway.
Did he get hit by, hit by a vehicle? Like they were,
I think so, but there was no vehicle there when we got there.
Was it hit and run?
Could be. But there wasn't blood strewn everywhere. So, and he was, I'd say a good 100 feet away from the overpass. So something happened for him to be there. And again, how would he break his leg that bad in a chunk of bone? I don't know. Um, I remember another one was pretty gnarly. I felt bad for him because the dude was in the Navy at the time, and he and his wife were out riding a motorcycle. It's Saturday morning, so they're out cruising on a motorcycle, and they're pulled off to the side of the road. Here comes a car, sideswipes them. It nearly amputated the lady's leg. His femur was busted, so we put a traction splint on him. And the other thing about him too was that he was dragged, and you see the marks on the roadway where you see the boot getting ground down. You see the black streak as the boot is getting shredded down, and then it turns from black to red. He actually had his toes shredded off. I don't remember how much of the toes. Um, but the big thing, one, we had the femur fracture, and then near amputation of his leg too. So I'm sure he was medically discharged after that. He couldn't continue because of that injury. So, I mean, that kid, I still remember the kid's face. It was a young kid, 16 years old. I thought at first it was a suicide. Till years later, I found out what happened. I remember I dreamt that kid because I was working the graveyard shift. So I got home and fell asleep, and I had a dream about the kid because it was bugging me. You know, what would drive a kid to commit suicide that way? And then I was actually telling that story to an EMT class. Maybe it was a first responder class. They're like, "Oh yeah, I remember. I used to live out there." He wasn't a suicide. He was tagging the sign. It's like, oh, okay. So that I kind of got relieved to know it wasn't a suicide. So, but that one sticks out. But you got to think about the forces on the body. I guess that's the biggest takeaway. What forces are on the body when it's involving multiple systems? They're probably going to be a load and go. Okay. You remind me of the girl from The Ring there, Rosie. Yeah, all dark and white face and.
Flip your hair over.
Yeah. It's scary shit. I know what Pa would say.
Paul's not here, so.
I know, so I can talk shit.
Yeah.
He missed it.
Oh, look,
You missed
came
it,
back.
bro. You missed it.
That what?
You missed
Nothing.
it.
Whack. Luis, what did they say, Luis?
You missed him.
Anything, Luis, or we're not
They
gonna
didn't
be
miss
sharp.
anything.
See?
No,
There you
actually heard Paul say that it's a good thing he doesn't have to wake up to that.
Wow. Good shit, Paul.
Hell yeah. Ain't that the truth?
All right, man. Wait till I see you ass tomorrow. If you don't go in cardiac arrest.
Traumatic arrest. Oh, that's another thing too, guys. Thank you for bringing that up. If a patient is in cardiac arrest due to trauma, we call it a traumatic arrest. The odds of bringing them that back are very, very slim. So more often than not, we're not going to try to resuscitate because the odds are very slim. All right, you guys have any questions?
No, sir.
Nope.
All right. So Christina told me when I talked to her this morning, as you guys saw, she said she's hoping to hear back from Elite and Dominion for sure on the ambulance rides. And again, the delay was getting everything together to be submitted to Christina to be submitted to the ambulance companies. So that's been the delay. I would rather you guys not go out to Sierra Blanca on class days, but if I have to do that, I will open up more shifts, so you guys can get out there. Elite is coming up. Now, one thing I told Vanessa I was going to do this. I'm going to invite her in. I'll set up a time where she's going to log online, and she actually is one of my night students. But Elite is recruiting. So I will have them come on and kind of give you guys their sales pitch to go and work for Elite. I'll try Dominion too. See if they want to come online and try to give you their pitch. I doubt Life will do it, and the only good thing about Life is they have a lot of county. Nice neck there, Rosie.
Becky, do you have hickeys on your neck, Rosie?
She does.
No, I don't leave hater marks or let hater marks are left on me.
She's like, I can't show you where the hickeys are at.
Yeah.
So, but anyway, so that's gonna be coming up. But as far as your write outs, she said that if she doesn't hear from them today, she's gonna call them either this evening or tomorrow to see what's up. Okay. What else? What else? Is it who's not going tomorrow?
Me, sir.
Just kidding.
Okay.
I probably won't be either because I do see my grandparents on like a weekly basis.
Okay. So what we'll probably do is, for those of you who are not going to be there, actually I'll send it out to everybody, but I want you guys to practice your assessment because medical or trauma assessment, as well as medical, those are required skills to pass in order to pass the class. And by not going, you guys are kind of missing out on stuff. I will see about maybe live streaming the scenarios so that way you guys can see. But you guys need to be able to do an assessment in order to pass the class. So I highly recommend you practice, videotape it so I can correct it, practice some more, and then get ready for a final assessment.
Well, instead of doing the online, why don't you do a one-on-one where it's just you and the other person, not when the whole class is there?
Run that by me again. Rosie, run that by me again.
I was saying that instead of doing the online thing, because obviously all the equipment's in class, why don't
Not
you just do
necessarily.
a one-on-one?
I got 28 of you. How many? 20, 24?
Yeah, but not everybody shows up. That's what I'm saying. Like,
I
make
know,
an
but
appointment.
regardless, I still have 24 of you. So there would have to be 24 individual tests. It doesn't matter if they don't show up or not. It's still 24 individual tests. You see what I mean? So continue with your idea. Continue with your idea.
Well, no, I'm just saying, like, do a one-on-one where there's not skills in class. Just go make an appointment and be like, oh, I'll show up today after class is over to do a one-on-one.
Yeah.
Because it's better to do it in person in skills because it's not like you're going to do skills on video when you're like doing the real work, you know? You have to really be hands-on.
Okay.
That's my opinion. I don't know. You guys want to? Sequoia?
Yeah.
And she's copying me with her arms crossed.
I know you two, like I said, you two are like two peas in a pod.
No,
Heaven help Paul.
Well, Paul needs to be Shrina, that's why.
I think Paul has a lot of kissing up to do tomorrow.
Leave my boy alone.
You can't leave. You're not to be new too.
Yeah, That's funny what Lou just said.
What?
A lot of kissing up to do.
Yep.
Nope.
Luis, you're in this too. Remember, you're like against us now.
You see how they take 1 inch and make it like a foot?
Of course.
Yep.
Oh gosh. Just bring me my iced coffee in the morning, please. And
Oh yes, sweetheart. Anything else?
sausage muffin with egg and cheese, please.
Do you want it room temperature or how do you want it?
The way you always bring it. The way
Oh,
you always
okay.
bring it.
I don't think I want to know how she brings it.
I'm not the one who brings them a griddle. That's the Koya.
Thank you, babe.
I would tell the ladies to
So anyway,
Make it 2.
You want more donuts?
Those are good.
I want some donuts.
it means I got to be there at 7.
Yep.
Diggity.
Um,
Don't worry, Lou. Paul will actually bring your case this time.
I'll bring what?
Exactly.
I'll bring
do
what?
we stutter?
Exactly.
Yeah, you did. I'll bring what?
You need
We don't
hearing?
repeat ourselves, Pooh. Paul.
Yeah, I need my hearing aid.
We'll go get
Yeah,
him.
turn it up.
So selective hearing.
I think I have a better chance of the last 5 Sports Illustrated swimsuit issue cover models coming to me and saying, Lou, we'll do whatever you want, than Paul bringing me a case of monsters.
Yeah, I agree. Oh,
Damn, Lou.
damn.
Shots fired.
Yeah, I wouldn't hold your breath either.
Let me pass my test first. God.
Excuses, excuses.
You know.
All right. All right. All right. All right. All right.
All right, all right, all right.
Mhm.
All right, guys. So any questions on multi-system trauma?
Paul, make sure you bring your cane tomorrow or you won't fall.
Yeah.
No,
That's
no
me,
questions,
yes.
Lou. No questions, Lou.
The wheelchair. He got put it in the wheelchair now.
They're clearly ignoring you for whatever reason.
I'll get you a hoverboard.
That's all right. I'm used to it. I am very used to getting ignored, so nothing new.
Me too.
Do what?
I said me too. Just because they talk mess about me, they never answer my questions.
What is your question?
I
I
couldn't
don't even
hear
have a-
you.
See?
Mouthful.
She can't hear me. What's my question?
Um. We're over here starving and shit, and he's over here eating. Like,
You
okay.
already ate?
So I'm just kind of waiting to see what questions you have. Anything else? I got students texting me. Since some people are not going to be there, are you guys wanting to move around the schedules? Number one, I didn't want to have 2 people coming in at 2:30 because that's not enough to really do anything.
So what I told them was that it was just going to be from 7:30 to 10:30ish, and then 11 to. But whoever was the last group was supposed to go in 11 o'clock.
Paul's making too much noise, so I muted him.
Freaking loud ass.
Rude.
All right, so guys, how do you want to change the times if you want to change the times? Again,
think
I would
the way-
prefer, but I'm okay with that the couple people that are in the 2:30 group, if you can come in earlier, because I think there's room for everybody.
Yeah, that's what I was
Yeah,
gonna say.
Not everybody's
that
gonna be
works out.
just
The two
make it
people that showed up.
7:30 to 10:30 and 11 to 2.
Yeah, that's perfect.
Just stick to the same schedule that you have, but whoever's in the last group just come in earlier.
No, but
Yep.
what I'm saying is maybe somebody wants to go earlier to
That's
get
fine,
things over
'cause,
with,
like,
or maybe they want to go later because of whatever reason.
Maybe we should just get a head count of the people that aren't gonna go. That way we can see who can fit into the first and second times.
What's the input, guys?
Well, I mean, so far we've only gotten like 2 or 3 people that said they're not willing to go tomorrow. So that makes what, like 21 people going? Does anybody else want to go early in the morning, like 7:30?
Just leave it as is. It's gonna be confusing.
No, they just sign up, and when you reach the maximum number, then that's it. First come, first serve.
Put it back in.
How many people usually go in the afternoon after the 11 to 2?
Not much.
2.
We could just fit them into the 11 to 2. Or break them down into the first and second.
Should I just say, guys, contact the officers, let them know?
Yeah,
Even
it's not
if-
confusing.
Even when
Yeah.
I tell them to give me the times that they want are available, they still don't answer me.
Then just leave it as is. Who doesn't show up, then that's their fault.
Hey,
I'm
guys,
not here to babysit either.
for everybody, if you don't feel comfortable because of COVID, I understand, but I want you guys to communicate that kind of stuff to me. The second thing is, if you don't show up, now you can come in and make up the skill. Just remember the class times that I have. On Fridays, I tend to come in a little bit later, but make an appointment to come in, or we need to figure something else out. Because I'm gonna tell you, there's certain people that don't show up and have made no effort to get a hold of me, and you're gonna find yourself not doing so good on skills, and then you're gonna struggle for your tests. And like I said earlier, you have to pass these skills in order to move on, or in order to be able to graduate.
Like, I understand the COVID and all that, but what are you gonna do when you're actually working? Where you gonna tell dispatch, oh, I'm not gonna go because there's COVID? I mean, there's PPE, you know what I mean? No, yes. Okay.
True.
No, that's you're exactly
Yeah.
right. In the healthcare industry, and you just got to deal with it.
I mean, this is the risk of the job. Just take
Yeah,
the
but again,
precautions.
I don't want to force anybody that doesn't feel comfortable. It is a risk, but don't get exposed before you even start. we'll work around the issues. But that's the thing is, you need to communicate with me or the officers, let them know or let me know, and we can make arrangements to get you caught up. But I know there are some people that when it comes to skills, they don't show up for skills days. And so how are you getting an opportunity to practice?
Oh, then that's their fault.
It is. It is. And so that's kind of where the statement is of, hey, we can only do so much.
We're not here to babysit.
Correct.
Exactly.
I think we can all agree that we just want to keep the same times. And like Sequoia and Rosie are saying, if you don't want to show up, just let them know. Whoever doesn't want to show up, and then we can keep
just
the
allow
of that.
or allow to have message me if you're not coming, because when you guys are scheduled for the skills and then you don't show up, then it just creates chaos, and then we're trying to even out with Paul and Lou of trying to do the scenarios.
So we're okay with keeping the same times, and then whoever doesn't show up, they don't show up, and then we can break down those people into the two groups.
Again, I'll post the times of what time you guys are scheduled for tomorrow, and if you guys don't show up, at least Lou or myself or one of the officers know that you are not coming in that day.
There's not even no need to post. We should already know how many times have we been on through this. We're not kids no more. Come on. We don't need to hold nobody's hand and be like, okay, guys, be there at 7:30. Anyways.
So anything else, Lou? Are we good?
Yeah.
All right. Have a good day then.
What's wrong with Paul?
What?
This is my first smoke. Yeah, I don't have anything. So if you're not going to be there, just say something that way in case somebody wants to go earlier for whatever reason. That way it opens up that spot.
Sounds good.
That's all I have to say. Again, I want you guys to go. If you have a fear, and it's totally understandable. We all have loved ones that we want to take care of, including ourselves. And me more so. I have my mom here. I have myself with my health problems, her with her problems. But if you guys don't speak up, remember, I think I told each and every one of you when you guys came into my office individually, I told you guys, communicate with me, because if it's too late, there's nothing I can do. We don't have a lot of time left. I might have to extend the class a week or two just to give you guys time to do your write-outs. Because technically after July 21st, the class is done, you can't do anything. So I need to extend the class date so that the ride-alongs count.
Why? Because people didn't turn in their stuff in time?
Yeah.
What does that have to do with us that we did turn our stuff in time? Why do we have to wait for the ones that didn't do their stuff on time?
And
they should wait for that week. We shouldn't.
Correct. But it's also an exercise in, there's other people counting on you.
Well, like we said, we can't hold your hand. We're all adults. You got to be able to meet us halfway. We can only take you part of the way.
All I have to say, honestly, and I don't want to sound mean, but you got to remember, if you or your loved one needs help from 911, think about who's responding to that call. Do you want them to know their stuff and be on top of their game, or do you want them to be,
Well, I mean, I understand on what part you're coming with that, but if the ones who participate and do their stuff, then they're the ones that know their shit. The ones that don't, then they shouldn't be on here and wasting our time and having that week for us to wait when it's not our fault.
There we go.
You know what I
My
mean?
mic's working now. Hey, I do need that extension though, because I've already picked those dates that you put to the 25th. So I need those extensions.
I don't agree with that. I'm sorry. I'm just speaking for myself. It's unfair for us to wait for the
Well,
people
no,
who
if
can
No
you
do
one's
get
stuff.
it done,
waiting on
that's
this.
fine.
Those are the dates that were
That's not a
available.
problem. It's just an administrative thing to the state. If we have to extend it. As soon as Dominion and Elite come on board, that's going to change the whole game. Just right now, what we have, it's hard.
I already picked up one for the 25th because that's all that was available. So if there's ones that are sooner, can I cancel that one and do the sooner one?
Oh yeah, yeah.
And I just get with you on that, or does it allow me to cancel?
You should be able to do it through Platinum Planner. If it doesn't, like somebody did it earlier and they said, "Oh no, it's not letting me." Okay, I will go on there and I will cancel you out. But usually, you put in the request, you go to the opportunity and just put in the cancel request, and then Christina and I will cancel it.
All right, sounds good.
All right.
Anyway.
I gotta go.
Oh, it is 12. So, all right. Well, you guys have a wonderful day. Please text me any communications, anything. And I will see you guys tomorrow morning. Some of you bright and early.
Yes, sir.
Have a good day.
Sounds
All
good.
right. Bye, guys.
Goodbye.
Bye.